An estimated 1/3 of the world's population is infected with tuberculosis. 1/3. And here's the culprit, the minuscule bacterium called Mycobacterium tuberculosis. But does that mean 2.3 billion people are sick? Fortunately not. Only a small proportion of them actually become sick. To understand why, let's take a closer look at the bacterium itself. When someone with TB coughs, they expel little drops of saliva that fly into the air. Some of them may contain the TB mycobacteria, which can then be inhaled by someone close by. The mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. And this is where it all becomes a little more complicated. The body detects the invasion and sends out its first line of defense. This includes special cells called macrophages, which engulf the mycobacteria and transport them to the lymph nodes, where they are neutralized. If they're neutralized, the person will have what is called latent tuberculosis. This means they're infected with the bacterium, but they don't have active TB disease, and they're not sick. However, in 5% of cases, the immune system is overwhelmed. The TB mycobacteria multiply and escape, and the person falls ill. This often happens with young children, whose immune systems are not fully developed. In other cases, latent TB can wake up and become active TB. This can happen months later, or even years later, especially in adults with weak immune systems. For example, people who are HIV positive, or who've had organ transplants, or who are undergoing chemotherapy. Once in the lungs, the bacteria may spread via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, the central nervous system, the liver, or the heart.
Symptoms of TB. A cough for 3 weeks. Loss of appetite. Tiredness. Fever. Weight loss. Night sweats. TB is curable.
Treatment. If not treated, active tuberculosis can be fatal, killing up to 60% of patients. When treated, a cure can be achieved in 90% of all cases. Successful treatment of tuberculosis depends on cooperation between the patient and doctor. Patient education is essential, and many doctors prefer to hospitalize the patient in order to observe him or her during treatment. The treatment consists of taking more than one medication for a duration of months. The following are some of the medications used to treat tuberculosis: isoniazid, INH, rifampin, one brand name, Rifadin, ethambutol, brand name Myambutol, pyrazinamide. Some of these medications may have very serious side effects, and some should not be combined with other medications or with alcohol. This is why it is very important to take them under your doctor's supervision and follow his or her recommendations and suggestions. People who have been treated for at least 2 weeks are usually not contagious anymore. Patients who do not take their medications as often and as long as prescribed give the bacteria a chance to become resistant to the treatment. This is why it is very important to follow doctor's instructions. Prevention.
As I conclude the features of TB, this table summarizes the chapter. Thank you and good luck, guys.